Welcome to The Explainer. Today, we're cracking open the Veterinary Ophthalmic Toolkit. We're going to look at 4 key classes of drugs, how they work, when you should and shouldn't use them, and we'll really dig into some of the critical differences between species that can make or break a treatment plan.
So here's our game plan. We'll kick things off with a drug that helps manage tear production. Then we'll dive into 2 different ways to dilate a pupil. After that, we'll cover the go-to local anesthetics, and we'll wrap it all up by showing you exactly why one size definitely does not fit all when you're treating animal eyes.
All right, first up is pilocarpine. Now, this is a pretty specialized tool for a very specific kind of dry eye that we see for the most part in dogs. So how does this stuff work? Well, it's actually pretty clever. In a dog with what's called neurogenic dry eye, the nerve that's supposed to tell the tear gland to work is broken. But the gland itself, it's perfectly fine. Pilocarpine basically acts like a bypass for that broken wire, going straight to the lacrimal gland and telling it directly, hey, make some tears. Now here's where it gets really interesting. You might see ophthalmic solution and think it goes in the eye, right? Not for this condition. We actually give it orally, putting the drops right on the patient's food. The whole idea is to start low and then slowly bump up the dose until you get that tear production back where it needs to be. The trick, though, is that you've got to watch for signs of overstimulation, because this drug is activating that whole system. If you give too much, you can get side effects like a ton of drooling or excessive urination. If you start seeing these things, that's your signal. Plain and simple, you gotta back the dose down. Okay, let's switch gears and move on to our next category, sympathomimetics. These are mydriatics, which is just a fancy way of saying they dilate the pupil. Their main job is to help us get a really good look inside the eye during an exam. The mechanism here is pretty straightforward. Think of the iris as having 2 competing muscles, one to open the pupil and one to close it. These drugs stimulate the open muscle, the iris dilator. They tell it to contract, and that pulls the pupil open. What's important is that they do this without messing with the eye's ability to focus. You'll see here that these drugs are kind of like the sidekick, not the main hero. We use them to give a little boost to pupil dilation before surgery or as a tool to help diagnose Horner syndrome. But their dilating power just isn't as strong as other options, so they're not usually the star of the show. And here's a big word of caution. Even though it's just an eye drop, some of it can get absorbed into the body and potentially raise blood pressure. That's a real concern, especially if you have a teeny tiny patient or one that already has heart issues. So you gotta be careful. Okay, now for the heavy hitters of pupil dilation, the parasympatholytics. These are the real workhorses we use for everything from in-depth diagnostic exams to actual therapy. Remember how the last class stimulated the open muscle? Well, these drugs do the opposite. They block the closed muscle, the iris sphincter. And that sphincter muscle is way more powerful, so when you block it, you get a really significant dilation. They also paralyze the muscle that controls focusing, an effect we call cycloplegia. This is a super important slide because it puts it all side by side. The sympathomimetics, they give you simple pupil dilation or mydriasis without affecting focus. But the parasympatholytics, they give you a much stronger mydriasis, plus that cycloplegia, which paralyzes the focusing muscle. And that second action is absolutely crucial for treating painful conditions like uveitis. And this is where things get, well, wildly different depending on your patient. Proparacaine is the short-acting one, perfect for a quick exam. Atropine is the long hauler for treating inflammation. But just look at that duration. In a normal dog's eye, atropine's effect lasts 4 to 5 days. But in a horse, that same drug can hang around for up to 14 days. So while this stuff is super effective, there are a couple things you need to be ready for. First, these drugs taste bitter. So when they drain down into the mouth, get ready for some serious drooling. And, of course, with a pupil that's wide open, the animal is going to be really sensitive to light. All right, last but not least in our toolkit, let's talk about topical anesthetics. These are absolutely essential for doing a lot of common procedures safely and without causing any stress or discomfort. So how do you numb an eye? You basically tell the nerves to be quiet for a little while. These drugs work by blocking sodium channels in the nerve cells. If you stop sodium from moving, the nerve can't fire off a signal, which means it can't send a pain message to the brain. This gives you a nice, numb surface to work on for things like checking eye pressure or grabbing a cytology sample. And yup, you guessed it, we've got more major species differences here too. Take a look at proparacaine. A single drop works for about 45 minutes in a dog, but in a cat or a horse, you're only getting about 25 minutes. And you can see with tetracaine in horses, a stronger concentration gives you a longer duration of action. Okay, everybody, listen up, because this is probably the single most important warning in this whole talk. Topical anesthetics are for procedures only. You must never, ever send them home as a treatment for eye pain. Using them repeatedly is toxic to the cornea and can lead to horrible, non-healing ulcers. This is a huge, hard and fast rule in ophthalmology.
So we've touched on these species differences a few times, but now let's really hammer home why this isn't just trivia. It is absolutely critical to getting patient care right.
Think about this for a second. In a horse, a single therapeutic dose of atropine can keep that pupil dilated for up to 2 full weeks. That is a very long time for a prey animal to have to deal with intense light sensitivity. Now let's compare that to a dog. Same drug, and it wears off in just 4 to 5 days. That's a massive difference, right? It changes everything: how we plan our treatment, how we manage the patient's comfort, and what we tell the owner to expect.
And this table just lays it all out. Side by side, it brings it all home. From the super long-lasting effects of atropine in a horse to the shorter numbing time of proparacaine in a cat, it's the perfect reminder that when it comes to eye meds, you just can't treat every species the same. So, I want to leave you with a really cool question to chew on. The source material mentions that the pigment in the iris, what gives an eye its color, can actually act like a drug reservoir. It can soak up the drug, maybe making it act slower, but last longer in a dark, heavily pigmented eye. So that raises a fascinating clinical question. How much should a patient's eye color actually influence our drug choices and our dosing strategies? Something to think about.